Well, I experienced a lot of pain in my lower back, and it was so bad that I couldn't even turn over in bed. It just hurt so bad. I couldn't get out of bed, I couldn't get in bed, I couldn't get off a chair. It was just really hard. I'm getting there. It's a lot easier to get off of a chair. I don't hurt when I turn over in bed. I don't hurt when I get out of bed. The pain is subsiding quite a bit. I still feel achy at times, but nothing compared. I don't have pain. There's a difference between aching and having pain. My doctor, I went to a back doctor that did a laminectomy, and so this was 4 years ago. So I went back to him thinking, you know, I have trouble with my back. He sent me to 6 weeks of physical therapy, and I completed that. Still nothing. It still hurt. It was just awful. So I went back to him, and he said, there's nothing I can do. He said, until we can replace the whole spine, there's nothing I can do for you. And left it at that. They can't do surgery. There is no surgery. That's what my surgeon said. There's nothing he can do for me until they can come out with replacing a whole spine. So my son and daughter-in-law come here periodically, and they kept on kind of bugging me. Why don't you try Dr. Jody? And I said, I don't know. I wasn't that enthused about a chiropractor. I mean, if a surgeon can't help me, how can a chiropractor help me? But just to give in to them more or less and appease them, I came here. And I'm glad I did. But that was all. I went to a rheumatologist many years ago because I was starting to have trouble with my knees. And they put me on Celebrex. Didn't do anything for me. And when I had the knee replacement, they put me on different drugs. I'm not one to take any kind of, you know, they don't seem to help anyway. So all I do is take one Aleve every day. I've never gone to a chiropractor before, so I've never had treatment any place like this. It's completely different than physical therapy when you go there. Oh, they're wonderful. We laugh and laugh and laugh. We're always laughing. I mean, in fact, my daughter said, Mom, because I was actually Xing out on my planner the days that I went, and oh, I have so many days left. And she's, Mom, I don't know why you do that because you enjoy it so much. You're going to miss it. Well, today would have been my last day, and according to the x-rays, I'm not quite where I should be, so I should come back for another 4 to 6 weeks, 2 or 3 times a week, just to get the adjustments and the blocking of my spine. Mm-hmm. Right, Dr. Hartz is here, and Kayleen is here. She's a nurse practitioner. So they have 2 medical people on staff. It's wonderful. I think it's wonderful because, first of all, I'm on Medicare, and Medicare does not cover chiropractors at all, except like in this situation. Mm-hmm. So for me, it works real well. Well, I believe that combining the chiropractor and the medical is great for no other reason than for the seniors that are on Medicare, and they don't usually pay for any kind of chiropractic work. And this way, they do acknowledge it, and they do pay for it. I do it because they're here, and it's just part of. They just send me to Dr. Hartz. They send me to Kayleen when she's here, and whatever I need to have done. If I need a shot before I go in for the blocking, for instance, they did that once. They did. I was kind of sore in the shoulder, they gave me a shot there. Now, the chiropractor could not do this. So therefore, whatever you need, I only needed that twice. But I've talked to them, and it's just so much easier, and it just works out so much better if they can combine practices like this.